Hello, I'm here today with Dr. Lin from the Joshua Hernia Centre in Taipei. And Dr. Lin has kindly invited me along today to learn more about the Joshua Hernia Centre and what it is that the Joshua Hernia Centre does exactly. Dr. Lin.
Yes, welcome, Kevin. Joshua Taipei Hernia Center that we have been here for more than 10 years. And we just have a new one. And this one is specialized and for hernia patient and hernia surgery. And this new clinic is a day surgery clinic specialized for hernia and for pre-op surgery and the post-op care. So patient can come here on the same day and be discharged a couple of hours after the surgery.
Interesting. So the hernia surgery that you do, I've done a little bit of research on you on your website, and I've also seen some of your YouTube videos. Can you tell me a little bit more about the Joshua technique? Why is the way you do it, the Joshua technique, better than the traditional mesh technique?
Yeah, thank you. We accumulate the hernia surgery experience for more than 30,000 already. And we have patients from from the world, more than 50 countries. And this based on our experience, but not only the experience, and we use our own natural tissue reconstruction surgery. Our idea, based on the experience, our idea to repair a hernia is not just a suture, not just a repair, but a reconstruction. Because they are the natural tissue, that we integrate the natural tissue together so that in the future, no matter the recovery or the future daily activity or exercise, the muscle, the fascia can integrate and the forces strengthening together because the natural tissue sewing together can have a synchronized strengthening. And for the whole abdomen, they could function together as a unit. If just a mesh, that is the structure theory that it's just a tap, no matter on top of it or beneath with the laparoscope or robotic, and it's just a tap. So it's not easy to transfer the strengthening for the whole muscle, abdominal muscle wall. For example, it's like a balloon or a ball. You won't like a ball, there's a defect to transduce the force, right? So you like that it's integrate as a whole unit.
Yes.
So we insist the natural tissue repair for the hernia surgery. Then we're lucky that, that the successful rate is very high and very, very low recurrence rate.
Yeah, I've been lucky enough to spend a couple of days here and meet a lot of the patients that have come through the door. And for me, it's been very, very interesting to see patients from different ages, different backgrounds, different physical capability. And they come here and they're a little bit nervous because they're about to have surgery. But I've seen firsthand each patient walk in, have the surgery, very quick, very easy. Like you say, minimal incision. The anesthesia method that you use as well, very low dose anesthesia. So they come round after surgery very, very quickly. And not like surgery I've seen before. The surgery that I've seen before, for example, in the UK, they give them a very heavy dose of anesthesia, very heavy load of propanol with also the incubation.
I see.
And that on its own, even without the surgery, can have a huge effect on the patient's recovery. It takes them a long time to recover just from the anesthesia. So what do you think the benefits are, the anesthesia method that you use?
Yeah, for auto design for specialized for hernia patient, I would like to say that in a modern way that everything goes to precise medicine. Precise means precise surgery, precise anesthesia, precise care. So in our specialized Joshua Taipei Hernia Center, we follow the way. I would say maybe we also created some new model for precise medicine, precise care. We use the natural tissue repair, but in a minimal incision way. Goes to about 2 or 3 centimeters. We have our own de novo innovational medical instruments, so that to archive the minimal incision.
So you've also created your own surgical instruments for this specialist surgery that you perform here.
Yes, and we have the USA patent for years already with the surgical method and with the medical instrument application. So that to archive the precise surgery. For the precise care, that we use the AI continually monitor before, during, and after surgery. The whole procedure where you go into this clinic, it's actually it's kind of kind of a hospital way, or better than most of the hospital to care the patient. So patient could be under all the monitor, all the care by the AI and the modern sensor. And for the precise anesthesia, we use the IV sedation, and with the local anesthesia, and with the very skillful nerve block by the ultrasound guided anesthesia, so that we can reduce the sedation and enhance the recovery time, and patient very happy after.
Yeah, I seen that today. Amazing how one patient that I seen today had the surgery so quickly, was only 10, 20 minutes out of surgery, and he was sat up in bed drinking coffee, smiling, talking. There was no adverse side effects from the anesthesia. There was no drowsiness or confusion that I've seen previously in other hospital models. So this definitely does seem to be a very new way of doing surgery, a very modern way. And also that leads me to my next question about the technology. You mentioned AI, and I did see some of the systems here today, such as wireless patient monitoring system. So you can, of course, I've seen like the ECG monitoring, observations, oxygenation, heart rate, blood pressure, all wirelessly monitored by the medical staff. Without they don't need to be in the room, they don't need to see the patient to see this on their screen. Could you tell me a little bit more about the technology that you implement here in Joshua?
Yeah, with the precise care, that we think the modern technology, including over the very good and sensitive sensors, including the oxygen, including blood pressure, including the heart rate, including the sympathetic tone, sympathetic recovery. We have a lot of information from this. I mean, during all the procedure, no matter the pre-op, the operation, and the post-op, patient's physical signal makes sense. Really teach us a lot. So we learn from what their response during the surgery, and correspondingly, we decide what we should do for that. And luckily now we have AI. So AI can alarm us what you do. And also AI is like an angel to care the patient together with us. And AI, I think very soon that will help us as a prediction. So AI already our team member. So we work together, sensor and the cloud information, and all the receptor has been set here, and we have the algorithm to calculate physical signals to to understand more about the patient's condition.
Mm-hmm.
So it's a good. I mean, it's helped all the medical staff to understand more how to care the patient, and that we can understand more deep about and more detail about the patient's condition and how to care, so that we and now the patient here and with the AI based sensor system and all the working staff, including nurse. So we work very well together.
Yeah.
Yeah. So patients smile after surgery when you wake up. Patients smile when they have tea or coffee after surgery.
Yes.
Patients smile and happiness after the surgery. And patients smile while they are shaking hand, say bye-bye to us.
Yeah.
It's most satisfactory.
I've witnessed it today, and of course, just for the viewers, I am wearing your kindly donated scrubs, but we are in a sterile
It's good to have
environment.
you.
I've been, of course, in a sterile environment today with Dr. Lin, so of course we have to take precautions and gown up, wear masks, etc. As this is a very, very, very clean environment, I must say, compared to a lot of hospitals I've been in. And while we're on the subject of AI, I notice on your website that this is a registered smart hub for day procedure surgeries. I seen there was a.
Oh, it's we are the government, Taiwan government is sponsored. Then we are the smart health demo site.
Yes.
Yeah, for the specialized surgery center. Yeah, and probably that we are very in advance for this, and but most important, patients recover. Yeah, it's a very good utilization. So many countries, including Japan, including Indonesia, including the team from USA, they came to visit us. We would like to share our experience.
Yeah, and that's what we're here to do today. Share exactly what it is you're doing here today to other people.
Yeah.
So do you think the mesh-free method, the Joshua method, is everybody suitable candidate for this surgery?
Yeah. For the for the past 30 years, mesh has been innovated and developed. Mm-hmm. So lots of surgeon takes mesh for hernia repair because it's much simpler. It's much easier to learn. However, well, in our experience, that we think natural tissue repair works well because the structural way, mesh is just a tape. So think about the mechanical force, the mechanical structure. You shooing it together, right? So it's traditional way. Then you tape a mesh. It's a like a thread.
Yes.
It's a tape only. So the mechanical structure, it's also a thread, a 2D. What if you can do to a 3D way as a reconstruction? Okay, in this way, I think it's nature and it's stronger, and it's more functional, considering the future exercise.
Yes.
Also, we learn from the Bible. The Bible say in the Marco chapter, they say that no one put a pieces of clothes onto an old garment because it's not synchronized. It could not integrate.
Yes.
So the better way is you showing in a stereo structure way. Is this way. Someone might consider, well, in this kind of showing, it might take stronger force, so getting higher tension. Well, I won't say that would not happen because we have some structure and showing technique.
Mhm.
Yeah. First, we use the endoscope dilatation, and so that we have prepared for the surrounding tissue to getting separating with the muscle, so that could allow the muscle can sewing close together. If you don't doing this, so that underneath structure, the preperitoneal space, which is like the just on the on top of the abdominal cavity, will still adhere to the muscle, so that it's not have good space. You don't have good enough space to allow the suture. You only this, but you can, if you do like something flattened, something preparation, you have space, so you can put this together. In this way, you reduce the unnecessary tension.
Yes.
And for the shoeing, because of the shoeing, it's like a lattice work. That's work to separate the different anchor into much numerous anchor, so that to allow to how to say, to you have more anchor point, right?
Yes.
So that you can diverse.
Yeah. And of course, I've seen the video.
Diverse, yeah, the diverse the tension.
The video you have on your YouTube channel, on your website also, the Joshua Hernia Centre Taipei. Sorry, you can find that explanation video on your website, which is really good at explaining how exactly you do that technique, the suturing technique that you do, that you just explained as well. So it's very easy to understand for anyone out there if you want to go ahead and look up the Joshua Hernia Taipei Centre here in Taipei. You can find that on YouTube, and of course the website. There's a lot of information on there which I've read, and that includes the 30,000 surgeries that you've done. I'm guessing by now it's more than that probably, but that's just amazing. To even think 30,000 patients is a huge amount, and your success rate as well is like phenomenal.
We focus on one thing. We focus our strategy. We focus on one thing. So all the team here that we done for the surgery every day, and the surgery. Well, I would say everyone's surgery are different. As our in the historical successful hernia specialist doctors, they say everyone's hernia are different. I agree, because we go it as a reconstruction surgery. It's like a plastic surgery. Plastic surgery. It's not just a tape. So, well, we think it's an art. Different kind of material, but you got to make into an art.
Yes.
And the state of the art. Then you patient or your art or your stature, the new structure, once you complete it, then patient will walk immediately.
Yes.
Then patient go home on the same day, or then
it's amazing.
Then they, well, as an artist, you will feel very happy because your stature is live.
I mean, I can't imagine how you must feel helping all of these people, because even me today, I'm only an observer, and for me to see people coming here a little bit nervous, not really sure what to expect, and then they have the surgery very quickly, they are out, they are recovering straight away, and an hour later they're leaving, and with smiles on their faces.
You're a witness.
I'm the witness, and for me to see that today, it's very easy for me to read it on someone's website. It's very easy for me to hear a story, but I've witnessed it today with my own eyes, and I felt really happy to see those patients leaving like this. And I'm just an observer, so to think how you must feel as the person who actually healed them, the person who performed that surgery, witnessed that success of that surgery, and knowing that you helped that person go on to lead a better pain-free life. That must be amazing.
Yeah, we enjoy this job actually,
Yeah.
and all team here, everyone very happy.
I can see, and
yeah,
I can feel when I'm here. It's the atmosphere here in the Joshua Clinic is just amazing. It's so relaxed, so comfortable. Everyone is so welcoming. That's what I've experienced today. And I really would recommend anyone to come here that's thinking of having hernia surgery. Maybe they've been told that they need hernia mesh surgery. I would personally ask those people to reach out to get a second opinion, because mesh, I don't think it's the way, personally. Just from what I've learned here today, what I've read from your website and what you've told me and what I've witnessed, this seems to be the more advanced future way of being healed from hernia, I think.
Yeah, most of the people thinking the natural tissue repair is a traditional way. I would say we develop from the traditional, and then we develop with the new instruments, the new sculptic innovation, so that we can go minimal incision, and we utilize the modern instrument, modern machine to apply the precise anesthesia. So, well, everything going well. We are lucky.
Yeah. Well, thank you so much, Dr. Lin, for inviting me here today. I've had a really amazing day. I've learned so much today, and I feel very, very privileged to have met you, met your team, and the patients that came here as well. So thank you to those patients for also allowing me to talk to them and sharing your stories with me. That was very humbling. And again, if anyone is thinking about having hernia surgery, they've been told that they've got a hernia, and they're a little bit concerned, I would ask that you reach out to Dr. Lin and his team at the Joshua Hernia Clinic in Taipei. You can find them on YouTube. They have a website, and I will add that in the description also, so you guys know where to go. And Dr. Lin is, as you can see, very, very helpful. Always happy to communicate with anyone, and I'm sure you'll help if you can.
Sure. And God did us. Thank God. Yeah, very nice to have you. And we are lucky to going in a new modernized hernia way. Our team will be led by God, and we keep going. We actually, patient is also our friends. So we make a lot of friends all around the world. See you.